What's up guys, my name's Talabla, I'm a final year medical student here in Sydney, Australia, and I'm also a bone marrow transplant vlogger. Welcome back to the channel. If you're new here, please feel free to hit the subscribe button. Otherwise, if you're a returning viewer, it is lovely to see your wonderful faces once again. In today's video, I'm going to be discussing something that everyone was really interested in from the video last week, and that is around, well, cannulation and blood drawing, and how it is that we can make it easier and better for you as the patient. Now, when it comes to blood drawing, there's something really important. When you're doing it, you've got to make sure that you get the curves right and the color just about right, and that's your blood drawing. I'm sorry. Look, I had to take that joke because if I didn't, you might criticize me for not taking the opportunity to make this kind of joke. Okay, so let's get serious and right into the content of today's video. The background as to why I think I can take this video and really will make it a useful resource for you watching right now is that as a cancer patient and someone who's very difficult to actually cannulate and get blood from, I've experienced all the different ways people have tried to do it and all the ways I've exhibited my own ability to have, well, self-control around that process. And then as a medical student and almost doctor soon to be, I've also learned the techniques that can kind of help enable a patient to get better at that. So I'm kind of combining these two pieces of knowledge that I've gained through so much experience now, and I have to share it with you because I think it's really gonna, well, essentially help you in your own experiences, because I know I can relate from my own cancer experience because it was so painful, and the pain itself was mainly from the fact that they had to do 6 or 7 times in all these different sites because it is so hard to draw blood from a cancer patient. So this video hopefully today can help alleviate some of, well, the fear that you might have, and also help you make your next experience getting blood drawn a lot easier, better, simpler, quicker, and hopefully pain-free. I think that sounds like a pretty good sales pitch if you ask me.
Nobody makes me bleed my own blood. Nobody!
Now, I just want to cover something that I think is, well, really empowering for a patient to know, and this is something that I actually share with a lot of the patients that I end up drawing blood on, because when I learned it for myself, it made it so much better when I was getting blood drawn for myself, knowing this knowledge, and I just thought, why don't other people know this? And the first thing is that when it comes to actual experience of pain when we get our blood drawn, so there are only 2 moments in which we can feel pain. And that is the first moment when the needle penetrates through the skin, and the second moment is when that needle then penetrates into the vein itself. Otherwise, that point in between, so that's between the skin and I guess kind of the tissue space between that towards the vein, well, that we don't actually really feel the pain. We feel a pressure, but we don't get the experience of pain. Unless, of course, the person doing it happens to, well, prang a nerve or something, then that is very uncomfortable. But the main thing here is that when we feel that pressure, individually we can tend to hype that up to actually become pain, and we kind of produce this pain response when there isn't actually any painful stimuli. And so I think that's really kind of empowering, because when you're sat there and if you actually watch it, which if you can, I would strongly encourage, because it really gives you a lot of control over it. And that is that you can clearly watch the 2 events happening. The puncturing or the piercing of the skin, that's your first pain. And then as they're finding the vein underneath, there's no actual pain to that. There is a pressure, don't get me wrong, I know. But there isn't pain during that process. The next bit of pain is then when they go into the vein. And that's it. They're the 2 pain events. Beyond that, there really isn't anything, which of course, unless they prang that nerve as I mentioned before, or even a muscle, that can be quite sore as well. And you have the right to go, fuck, that hurt quite a bit. Otherwise, just knowing that should prepare you quite a lot more, or at least make you feel, well, I think at least, a lot more empowered when it comes to getting your blood drawn. Now, as far as actually methods to make it a lot easier for you, the first thing that I would suggest is, well, a simple one, and that is fluids. Now, as you can see here, I tend to always have water right next to me on my desk, because I always have some fluids with me, because I know how important it is, and this is a 1 liter, well, container pretty much, but really, if you can get a lot of fluids in you beforehand, that makes it so much easier. You're literally going to contribute to filling your veins and making it easier for them to not only find them, but actually get the the needle into those veins and then draw the blood out. You're making it so much easier for the person then trying to draw it. This of course depends on you being allowed to drink and or eat before having your blood drawn, but provided that you can drink, I'd strongly encourage you to try to drink, if you can, at least 1 liter of fluids, and it doesn't actually have to be water. I know when I was really nauseous, water was the worst thing ever, so I'd say tea, coffee, cordial, even a bit of a sugary drink if you need to, and if that is if you can as well, but just some fluids to kind of help beef up and bulk up that blood volume really makes it a lot easier. And then of course, provided that you can drink and if you can eat. Eating and drinking beforehand really helps, surprisingly, bulk up your veins without you actually knowing, and it's a really easy thing that we can kind of do to make it possible. So make sure you eat and drink if you can, and if you can't, these next tips are directly for you, and if you can, I'd still consider these next tips anyway. Right, a reusable straw. I'm trying to be a better person. Now the next thing that we want to do is keep the site the blood will be drawn warm. Now what do I mean by that? So normally blood gets drawn on your arm, okay? That's where we tend to pull the blood out. And now there's 3 main common sites. You have the what we call antecubital fossa, which is kind of this diamond-shaped area here in your elbow crease. That's a really common place for the blood to be drawn. You then also have what we call the dorsum of the hand, which is just a fancy way of saying the back of the hand here. And then one of the more pressing and challenging ways is actually the forearm itself. Most commonly, they try to draw blood along the radial bone. So that's the bone here that is on the side of your thumb. So there's normally some good veins that they can access here, or even just in the forearm here between your wrist and your antecubital fossa, or that elbow wrinkle that I mentioned beforehand. So this spot here is also a very common place. Now, provided that they're going to draw blood from either of these spaces, what you can do beforehand is keep these spaces as warm as possible. So this means having a good shirt on underneath, a jumper, a coat, gloves. Really get yourself warm, because when you're warm, the heat brings the veins to the surface, whereas if you're cold, your veins actually tend to hide away from the surface. And so this is something I would really encourage you to do, is stay warm and keep the warmth there. Even to the point that I remember the most common place I like to get my blood drawn was on the dorsum of my hand. So what I would do is I'd have gloves, then I'd actually even sit on my hands as well, just to give a bit of pressure as well, but there's a lot of heat in those thighs as well. And one thing you can also do if you don't want to sit on them is just put them between your thighs as well. But I'm cautious on that one, because cancer patients are notoriously bad at putting things between their thighs, because, well, during chemotherapy, your thigh gap is, well, pretty exaggerated, so you could put your hands between your thighs and still not get any warmth, so I'm very aware of that one. But you really want to get a lot of warmth, so that's really the warmth for your hands. Now, if we're going to talk about warmth for, say, your forearm or in that antecubital fossa, a really good way of getting warmth there, on top of all of that clothing, is to also have something like a heated rice bag or one of those kind of warmers that they use during winter, and just place it into that area as well. I know when I was doing my clinical trial, we would have to use the veins around this site because my nurse practitioner found that this was the best site for them to put the cannula in, considering the size of the cannula. So what we would do is we get a heated rice bag and place it on my forearm under the blanket for about 10 minutes beforehand. And after that 10 minutes, it was beautifully clear exactly where the vein was, because the vein had jumped up to the surface based on the heat. So heat and warmth is the best thing to help bring those veins to the surface and make your experience a lot easier. Now, just a specific into, well, my favorite place to get my blood drawn, which was on the back of my hand, one of the little cheats that I could kind of do, and that was whether I was sitting in the waiting room or even when I was actually just sat in the chair waiting for them to prepare to get all of the needles and the cotton buds ready and the drawing tubes. One thing I could kind of do is with my arm that I knew they were going to do it on, I could actually just hang it freely off the edge of the bed or off the seat. And so if you just hang it freely with gravity like that, and you just kind of shake it limply and loosely like that, that just kind of adds a gravity effect. Now, obviously like this isn't ideal. I would suggest you to just hang it right between your legs like that, but it cuts off the camera so you can't see. But you want to just hang your hand quite loosely and limply like that, and allow gravity to bring all of the blood, well, to oppose the blood from draining back up the arm. And now on top of that, after doing that for a little bit, I would then encourage you to start squeezing your hand quite a bit as well. And what that does is that brings the arterial blood down into your hand. So that's bringing blood down into this part. And then with the gravity stopping the veins from being able to bring all the blood back up, what you're essentially doing then is you're bringing the blood down from the arteries, and then gravity is helping you keep some of that blood in your veins before it can all get back up in the rest of your circulation. So kind of getting the twofold effect there. That contraction of the muscles, bringing blood down, and then gravity preventing all the blood from going back up, and that really helps bulk up those veins on the back of your hand specifically as well. And that helps a lot, and I would strongly recommend that on top of my previous tips around getting blood drawn as well. And so of course, if you get all of these things right, it's all going to go a lot easier. But as I mentioned before, if you're someone that tends to get their blood drawn more commonly from, well, here on the radius, or on the forearm, or in your antecubital fossa, that heated bag is a lifesaver. Just a bit of heat there is just so good, particularly that direct heat. And that is just, I strongly recommend that to you because it makes your experience and the person drawing the blood a lot better. And then, the final hack, which is a little bit of a weird one, is just to kind of smack the surface of where the veins are going to be drawn. So for instance, it was my left hand that we always drew the blood from, and I actually in fact knew the best veins on my hands were the veins that run just from behind my pinky towards my wrist. There was a good bulk of veins there, and you just tend to know where the best veins are for you individually that are kind of, I suppose, the more trustworthy veins after a bit of experience. And because I knew this site was really quite reliable, what you can do is just smack that site, just a bit like that, and the veins start popping up to the surface. It's really quite funny how that works, but the veins start popping. I don't even know if you can see that, but just by me tapping it, like, it's not very warm in here at all, and I haven't done any of the other things I've just mentioned, but just that tap has brought my veins jumping right up, and that would be very easy to chuck a cannula in. So if you apply all of these things, that is the hydration, the food, fluid, the caffeine, heat, warmth, gravity, tensing the muscles, getting that arterial return to the peripheries, and just a gentle smack on the side too, you are going to find that your whole experience around this becomes so much better. Like, legitimately, these methods make it so much better. But the big one, of course, is to make sure that you tell the person that's drawing your blood, by the way, I'm quite a difficult person to get blood from. I've had a lot of chemotherapy, so my vessels themselves collapse or are quite difficult, because the chemotherapy itself actually damages your vessels quite severely, and so it makes your vessels, well, a bit atypical from the standard vessel that someone might predict and expect in a patient, particularly in myself, who's just a young person. So people tend to think these would be very easy veins, but they're a little bit trickier than the standard 26-year-old. And now if you're with a pro that's drawing blood, what they can sometimes use is an ultrasound, and these are amazing. They give such good accuracy and make your entire experience so much easier. So of course, if they can use an ultrasound, I'd strongly recommend you encourage them to use it, because the accuracy and the reduction of pain and suffering in your own experience around this is so much better. So of course, if they can, of course use an ultrasound. It's really, really useful in this kind of setting. But the above things that I've mentioned, all these things that you as a patient can do, make it so much better for your experience, and they empower, well, us as the patients to have control over this and think, I can go in here knowing what to expect, because you've done everything that you can to make this so much better for you, and as a result you actually make it better for the person trying to draw the blood. I really, really hope that this has helped, well, you quite a lot, and has helped prepare you for when you get your bloods drawn next. Of course, chuck down below in the comments any advice or tips or tricks that you personally use that have been, well, super useful, because I want everyone who comes on this video to find out as much as they can around making this process so much better. And I'm also really interested to know, where it is that you commonly get your blood drawn. As I said, for me, it was on the back of my left hand, right below my pinky. Just this little site here, I always got them to draw the blood from there. Otherwise, thanks so much for watching, guys. You've been amazing. I'll see you next week for the next video. Let me know, of course, if you have any video requests that you would really like me to do, because I'm happy to do any and all of them. Otherwise, as always, like, share, subscribe, and I'll see you next week in the next video. Thanks so much for watching, guys. Bye!